I think in Hong Kong, for those over 80, the statistics is that 1 in 3 will have dementia. And so there will be a huge number. Now, about 21% of our population of 7.3 million, it's over 65. So if we looked at that number, the number of people having dementia is going to be huge in Hong Kong. So if we don't tackle it all together from a society perspective or whole of society perspective, it will be very hard for us to take care of them or for us to help them age in place or age with dignity. Hi, I'm Patricia Lau. I'm the CEO of Hong Kong Sheng Welfare Council. The Welfare Council is actually the social services arm of the Hong Kong Anglican Church, and we run a range of services from cradle to grave, what I call, from babies to end of life. We have about 250 service units, and the bulk of my expenditure last year is actually spent on elderly care. That includes residential care, daycare, and reaching out to elderlies at their home or reaching out to private homes. I think the challenge is to engage, continue to engage, and to continue to innovate and think of activities, new programs that can help to engage the elderly. And sometimes we work with them to co-create programs. I think we are trying very much to support the elderly to age in the community and age at home until they become very, very frail. We wish them to stay in the community and be at home. Because I think the elderly people, they feel more comfortable at home, and now they have a longer age. Hong Kong has the longest age expectancy in the world. So if they can stay in the community, stay at home longer, and have preventive health care support as well, then they actually don't need to go to hospital that early. And so in a sense, overall, there will be a lot of savings in terms of our public hospital system, in terms of our health system and all that. And they also feel more happy when they age in the community. We work with the Chinese University of Hong Kong, so they did a bit of research on chronic pains, and they found that knee pain is one of the biggest worry and struggle for elderlies having pain. With knee pain, it means they can't go out as they like because they can't walk very nicely, and then with that they can't go to buy food, they can't go out with social activities, and they tend to then stay at home and avoid going out at all. That then creates loneliness and maybe create depression as well. So with the knee pain program, we put in an artificial intelligent mobile app together with motion detector function, and we have therapists to design a lot of motions for them to train their muscles so that they can reduce their knee pain. So in the last 4 years, we have been running that program. About 1,300 elderlies have been going through that program, and many have found that they can walk much better, like they don't have the pain at all. So it is very, very magical. It is just about doing more exercise, but the right exercise with the mobile app and with the motion detection mobile application. So we find that really innovative with technology, with AI, with motion detection, and with a multidisciplinary team creating that mobile app, creating the motions, creating the exercise, and then teaching them what's the right way. They can do that at home. They don't need to go to the centers. And we find that really, really effective. So I would encourage the entrepreneurs to get involved into community centers or elderly circles or networks and be part of it. And from there, they can identify pain points and maybe or work together and co-create, as I said, and use design thinking to think about solutions for the elderly. I think everyone in the society needs to understand the issue and be part of it to address it. and embrace it. So I hope in 3 or 5 years' time, dementia is not something just for NGOs, but it's for the whole community.